I'm Mark Green, and I have the honor of leading the Malaria Policy Center and working with great folks like you in this cause. You know, when I'm asked how it is that we're actually going to defeat malaria, well, like most of you, I have the stock answer down pretty well: insecticide-treated bed nets, indoor residual spraying, access to medicine, preventative treatment during pregnancy. That's what's on our website, and my guess is that's what's on your website as well. Well, that's certainly accurate, but I would argue that it's incomplete. To fall back onto an old saw, it can't see the forest or the trees. Because the real answer to that path to ending malaria deaths is, I think, something much simpler. It can really be summed up in but one word: leadership. That's what it's about. More than drugs, more than spraying, more than nets, it's leadership. And that's what we're here to honor and to celebrate this morning. It's leadership like that that you just saw with Mohammed Jadawi, the Principal Secretary of the Ministry of Health in Zanzibar. Mohammed's been in this battle for a long time, and he's seen how far we can all come. It's leadership like that of President Kikwete, who's not only leading his country's historic campaign against malaria, but he is the first chairman of the Africa Leaders Malaria Alliance, a gathering of heads of state from malaria-endemic countries to compare best practices and to nudge each other along a little bit. It's leadership like that shown by Ray Chambers and Peter Chernin when they co-founded Malaria No More just 3 years ago. Of course, Ray has gone on to be the UN Special Envoy, and Peter Chernin is our chairman, and he uses every opportunity, every tool, some would say every trick, to move this community forward. We're very lucky to have a number of malaria leaders with us here this morning, and I can tell you that we're very, very grateful. From the diplomatic community, we have Ambassador Sifue of Tanzania, whom you've heard from. Ambassador Mark Dybel, representing the UN Special Envoy's Office. We have leaders from the administration. Last World Malaria Day, President Obama said, and I'm quoting, "It is time to redouble our efforts to rid the world of a disease that does not have to take lives." His view and his team are well represented here this morning. In addition to our honorees, we have staff here from PMI, USAID, OMB, and of course the White House. And it's good to see the President's Chief of Staff here with us this morning. We have leaders from the other end of Pennsylvania Avenue, Congressman Don Payne and Congressman John Bozeman, co-chairs of the Caucus on Malaria and NTDs. It is now the largest global health caucus on Capitol Hill, and we are grateful for all that they've done. We have legislative staff leaders here this morning. We have them here from Bozeman's office and Payne's office and the office of Senator Russ Feingold. Now, those three gentlemen last year won our champion awards, but I think all of you know they wouldn't be there if it were not for great staff, and so we're very grateful. We have staff here from the office of Congresswoman Lois Capps, the Senate Foreign Relations Committee, the House Foreign Affairs Committee. We have leaders from Malaria No More itself here, like Scott Case, our CEO. From our board of directors, we have John Bridgeland, who's our vice chairman, Stephen Phillips, the medical director of international programs for ExxonMobil, and Senator Harris Wofford, who has been a warrior in this cause for some years. From the Policy Center's new advisory board, we have Natasha Villamoria, executive director of Friends of the Global Fight, TJ Patrizio of the Patrizio Strategic Group, Adam Waldman of the Endeavor Group, and Joe Menamano of World Vision. We have Sally Canfield here with us this morning representing the Gates Foundation. And the Gates Foundation not only got us going, the Malaria Policy Center, but I dare say has provided the juice for so many of the initiatives and so many of the projects that we're here to celebrate today. When I joined the Policy Center a little over a year ago, I told my team, probably more than they wanted to hear, that every message that we put out had to answer three basic questions. Why malaria? Why now? And why us? Now, the first two I hope you can answer. Should be pretty simple. Why malaria? Because no other single disease claims as many lives of African children each and every year than malaria. Why now? Because like never before, we have at our fingertips the tools to break the stranglehold of malaria. We have the chance to recover families and villages and countries from bed nets to spray to medicine to exciting new progress on vaccines. Like never before, it's before us. But why us? I think each of us has to answer that for him or herself. In terms of why us, the U.S., I think there are lots of reasons. There are ethical reasons and moral ones. There are strategic reasons and diplomatic ones. There are economic reasons and there are even political ones. But for me, the decisive reason is something very different. And I'd like to tell it to you in the form of a story. Shortly after I became ambassador to Tanzania, about 3 months into my term, my parents came from Green Bay, Wisconsin to come and visit me. And they wanted to see just what it is that their son was doing, but an ambassador does. My father's a physician of over 50 years. And so I brought him along with me as I went out to the countryside to open up a care and treatment facility that was funded by US dollars. And after we cut the ribbon on the clinic, we went to some neighborhoods nearby where we were delivering food to some very, very poor families that were being served by that clinic. There were lots of stops that we did, and all of them were very moving. But there was one stop that I remember more than the others. I mean, as I think about it, I can still picture walking into that rickety little building, which looked more like an abandoned farm shed than it did a place where families could actually live. There were no windows, but there were just enough holes in the wall for the sunlight to come through. And as we walked in, and our eyes slowly adjusted to what we could see, we saw our poor hostess sort of sitting on a box on the dirt floor, and she had her kids all around us. She was a little overwhelmed seeing 5 or 6 Americans come in. But after a while, when we opened up those boxes of food and grain, she warmed up a little bit. It didn't have a lot of visitors, so she began talking. Now her breathing was labored and it was noisy. She told us that her husband and one of her kids had just passed away in the previous year. And that, quite frankly, she was in the home stretch herself, and my father confirmed that for me later on. And as we were bringing the food to her, she said through a translator, "Ambassador, I just have one question." Okay, go ahead. She told us how she'd been a very successful businesswoman in her life, but after her family had been struck, the money was down to almost nothing. She said, "Okay, I just have a little bit of money left, just a few shillings. And the question is, should I use that money to buy textbooks for my kids who are healthy or medicine for the kids who are not?" And my father, I'm sure, has seen a lot of people pass away in his lifetime. But somehow this one was different. And he leaned over to me and he said, "Mark, can't the government do something?" I said, "Dad, there's no Medicaid. There's no Medicare. There's no welfare. There's no safety net here. The truth of the matter is, if we don't do this, it don't get done." We're facing lots of challenges these days. The economy is struggling. The remedies are painful. Government is facing deficits, and charities are strained literally to the breaking point. I know it's hard to ask Americans to send money overseas to fund programs like PMI and the Global Fund to fight AIDS, tuberculosis, and malaria. And we can all wish and hope that other nations would step up for a while and take over the leadership. They won't. And that's the simple truth. If we don't do this, it won't get done. And for me, that's the reason why we need to do it. On the bright side, what we're celebrating here this morning is the fact that we are leading and that it is getting done, especially through the work of the 2 men that we're honoring this morning and the great teams that they lead.